Did you know that one simple habit, something most men never think twice about, could cut your risk of prostate cancer by nearly 50%? In the next few minutes, I'm going to walk you through exactly what the science says about your prostate and how to keep it healthy at every age, from your 20s all the way into your 60s and beyond. Some of this will surprise you. Some of it will probably embarrass you a little, but all of it could genuinely change your health. The Healthy Dividend: Wellness Tips for a Richer, Healthier Life. Let's start with the basics, because a lot of men don't think about their prostate until something goes wrong. And by then, things can already be complicated. The prostate is a small gland, about the size of a walnut, tucked right beneath the bladder, surrounding the tube that carries urine out of the body. Its job is to produce the fluid that makes up semen. Sounds simple, right? But this little gland is responsible for an enormous amount of trouble as men get older. As men age, the prostate typically grows. By age 60, it can reach the size of a lemon, and that gradual enlargement sets the stage for most of the problems we'll be talking about today. 3 conditions dominate the picture: benign prostatic hyperplasia, prostatitis, and chronic prostatic inflammation, and prostate cancer. Together, they affect the vast majority of men at some point during their adult lives. But first, let's talk about what you were born with. Your genetic background is one of the strongest predictors of prostate disease risk. If your father or brother had prostate cancer, your own risk doubles. If multiple first-degree relatives were affected, or if they were diagnosed young, your risk climbs further. Specific gene mutations amplify that risk significantly. If you have a strong family history of prostate cancer or breast and ovarian cancer in female relatives, that shared genetic territory is worth discussing with your doctor. Now, let's walk through the 3 main prostate conditions: what they are, what they feel like, what causes them, and when you need to pick up the phone and call a doctor. Benign prostatic hyperplasia, or BPH, is the most common prostate condition, and despite the intimidating name, it's not cancer. It's simply an enlargement of the prostate that can seriously disrupt your quality of life. By age 65, up to a third of men experience noticeable symptoms of BPH. The core problem is mechanical. As the prostate grows, it squeezes the urethra, the tube running through it, making it harder for urine to flow freely. What does it feel like? A weak or interrupted urine stream. Difficulty starting urination. Feeling like your bladder never fully empties after you go. Sudden urgency, that "I need to go right now" feeling. And nocturia, waking up 2, 3, or more times per night to urinate. If any of those sound familiar, you're not alone. What causes it? Aging is the primary driver, combined with hormonal changes, specifically the accumulation of dihydrotestosterone, or DHT, in prostate tissue over time. Obesity significantly increases both the risk of developing BPH and the severity of symptoms, and chronic inflammation also plays a role. When should you see a doctor? When you experience any of the symptoms described above. There are highly effective treatments available that relax the prostate muscles and even shrink the prostate over time. For men who don't respond to medication, minimally invasive procedures offer significant relief with a quick recovery. Surgery is reserved for the most severe cases. Prostatitis and chronic prostatic inflammation is the inflammation of the prostate, and it affects up to 9% of men during their lifetime. Unlike BPH, it can strike at any age, including younger men in their 20s and 30s. It comes in several forms. Acute bacterial prostatitis is the most straightforward, a bacterial infection that causes sudden, severe symptoms and is treated with antibiotics. Chronic bacterial prostatitis is a persistent infection that requires a longer course of treatment. Then there's chronic pelvic pain syndrome, the most common and most frustrating form, which is non-bacterial, not caused by a detectable infection, and driven by a complex mix of factors, including pelvic floor dysfunction, nerve sensitization, and possibly the microbiome. What does it feel like? Pelvic pain or pressure in the lower abdomen, perineum, or genitals. Painful or burning urination, urgency and frequency, painful ejaculation, and in some cases, sexual dysfunction. These symptoms range from mildly annoying to severely debilitating. What causes it? Bacterial forms are caused by infection. The non-bacterial form is less well understood, but emerging research points to chronic inflammation, immune dysregulation, nerve sensitization, and disruptions in the urinary microbiome as contributing factors. When should you see a doctor? When you experience any of the symptoms described above. Acute bacterial prostatitis with fever can become serious quickly if untreated. Chronic forms need a proper diagnosis to rule out other causes, and management typically involves a combination of medications, pelvic floor therapy, and supportive care. Prostate cancer is the most common cancer in men and the second leading cause of cancer death, surpassed only by lung cancer. Risk increases sharply with age, family history, and African ancestry. Most cases are diagnosed after age 65. One important thing to understand: prostate cancer is not a single disease. It ranges from very slow-growing, indolent tumors that may never cause symptoms or require treatment, to aggressive, fast-moving cancers that can spread rapidly if not caught early. This wide variability is part of why treatment decisions are so nuanced. What does it feel like? Early prostate cancer usually has no symptoms at all, which is exactly why screening matters. As the disease advances, symptoms can include urinary difficulty, blood in the urine or semen, erectile dysfunction, and pain in the lower back, hips, or pelvis. These are red flags that require immediate medical attention. What causes it? Age, genetics, and race are the non-modifiable risk factors. But chronic inflammation, obesity, a Western-style diet high in red meat and saturated fat, and hormonal imbalances all appear to create conditions that favor cancer development. When should you see a doctor? When you experience any of the symptoms described above. However, if you haven't had a conversation with your doctor about PSA blood test and you're over 45, especially with a family history or if you're Black, that conversation is overdue. Why? Because the PSA screening can detect signs of prostate cancer before symptoms appear. Be advised that in any of the three cases, your doctor may prescribe a digital rectal exam, or DRE, which is another diagnostic tool where he feels the prostate through the rectum to check for lumps or irregularities. I know what you are thinking, but yes, it might be necessary. Here's where we shift from understanding your risks to actively doing something about them, because a remarkable amount of your prostate's future is in your hands right now. Physical activity is one of the most powerful tools you have. The nuance in the research is important. General moderate activity has a modest effect on overall prostate cancer risk. But vigorous exercise, intense workouts, running, cycling, heavy lifting, has a dramatic effect on the risk of advanced and fatal prostate cancer. Studies have shown that men who did vigorous activity on a weekly basis had a 41% lower risk of dying from prostate cancer compared to inactive men. And if you've already been diagnosed, physical activity after diagnosis improves survival and slows disease progression. Exercise also significantly reduces BPH risk and symptom severity. The mechanisms are clear. Vigorous activity improves insulin sensitivity, reduces chronic inflammation, modulates sex hormones, and strengthens immune function. The American Cancer Society recommends 150 to 300 minutes of moderate aerobic activity per week, or 75 to 150 minutes of vigorous activity, plus strength training at least twice weekly. Weight management is the second pillar. Obesity, especially belly fat and a large waist circumference, is strongly tied to advanced and high-grade prostate cancer. Research shows that for every 5-unit increase in BMI, the risk of advanced prostate cancer rises 8%, and the risk of dying from it rises 11%. Obesity worsens BPH dramatically and amplifies urinary symptoms. The mechanism is hormonal. Excess fat disrupts insulin, leptin, and sex hormone balance while generating chronic whole-body inflammation. Losing weight if you're overweight is one of the most impactful things you can do for your prostate. Smoking doesn't consistently raise overall prostate cancer risk, but it is clearly linked to high-grade, aggressive prostate cancer and to worse outcomes after treatment. If you smoke, your prostate is one more compelling reason to quit. Alcohol, moderate to heavy drinking, roughly 10 or more units per week, is associated with increased risk of high-grade prostate cancer. Alcohol also worsens BPH symptoms and can interfere with how well BPH medications work. Moderate mindful drinking is the smart approach. What you eat every day has a direct, measurable relationship with your prostate health. The dietary pattern that comes out on top again and again is the Mediterranean diet. Abundant fruits and vegetables, whole grains, legumes, fish, and olive oil, with minimal red meat and processed food. Cohort studies and clinical trials show that men who closely follow this pattern have lower prostate cancer mortality, slower disease progression, and better quality of life after diagnosis. Plant-based diets show similar benefits associated with slower PSA doubling time, improved urinary function, and reduced recurrence risk. On the other side, the Western diet, heavy in red and processed meats, saturated fats, and refined carbohydrates, is consistently linked to prostate cancer progression and death. If your daily meals look like fast food and processed snacks, your prostate is paying for it. On specific foods, tomatoes and their lycopene content appear protective against aggressive prostate cancer, particularly when cooked. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, may improve survival outcomes. Soy foods may lower PSA and modulate hormones protectively. Fatty fish rich in omega-3s can reduce tumor proliferation markers. Red and processed meats increase risk, especially in men who are also overweight. High dairy intake is modestly associated with elevated prostate cancer risk, possibly by suppressing vitamin D metabolism and raising levels of IGF-1, a growth-promoting hormone. You don't need to eliminate dairy, just don't overdo it. Now for the finding that's backed by hard data and that most men will find surprisingly encouraging. Studies have shown that men who ejaculated 21 or more times per month had a 31 to 49% lower risk of total prostate cancer compared to men ejaculating just 4 to 7 times per month. Every increment of 3 additional ejaculations per week across a lifetime was associated with a 15% decrease in total prostate cancer risk. These associations held after fully adjusting for age, family history, BMI, smoking, physical activity, and diet. Why? Researchers propose several mechanisms. Frequent ejaculation may clear the prostate of potentially carcinogenic secretions that accumulate over time. It may reduce the formation of prostatic crystalloids, calcifications linked to cancer development. And the stress reduction associated with ejaculation may lower sympathetic nervous system activity, which influences how prostate cells behave over the long term. No official guidelines set a specific number. This is association data, not a prescription, but the evidence is consistent. The biological mechanisms are plausible, and the habit carries 0 negative side effects. All right, let's get practical. Here are the most effective, evidence-based strategies to protect your prostate, and they're all remarkably simple. In your 20s and 30s, this is your foundation decade. The habits you build now compound over the next 50 years. Eat a plant-forward diet, exercise vigorously and regularly, maintain a healthy weight, don't smoke, keep alcohol moderate, and maintain regular sexual activity. You're not just protecting your prostate, you're setting the trajectory for your entire health span. In your 40s, add active risk awareness. If you are Black, or if you have a first-degree relative who had prostate cancer, especially at a younger age, have the PSA screening conversation with your doctor now, ideally around age 40 to 45. Consider genetic counseling if your family history includes multiple relatives with prostate, breast, or ovarian cancer. Keep all the lifestyle habits going. In your 50s, if you're at average risk and haven't yet discussed PSA screening, age 50 is the benchmark. Watch for early BPH symptoms and don't just accept them. Early intervention is easier and more effective than waiting. Stay active, keep the diet clean, maintain a healthy weight. In your 60s and beyond, continue the healthy lifestyle without exception. The biology doesn't stop mattering just because you're older. BPH symptoms are very common and very manageable. Get evaluated and explore all available options, including newer, minimally invasive procedures. Individualize your screening and treatment decisions with your doctor, accounting for your life expectancy, overall health, and what matters most to you. Active surveillance remains an excellent option for low-risk prostate cancer at this stage. At any age, do not ignore these warning signs. A weak or interrupted urine stream, increased frequency or urgency, waking up multiple times at night to urinate, pain or burning during urination, blood in urine or semen, or pain in the lower back, hips, or pelvis. These are not minor inconveniences. They are signals. Act on them. If you enjoyed this content, please like the video and subscribe to the channel for more updates.